Morning, dosto. My name is Kamal Yadav. Today we are discussing about the medical billing and denials or some related to concept which need to clear to all coders, billers, AR or all like who are related to the healthcare industry. So they will understood the medical uh, billings manuals or coding manuals which required to know each of us, right? So let's start this video and you will understood the what is the benefits, what's the terms in this video. So let's move to the slide. In last video I had discussed regarding this and how to how to work and how you can see that the differences of the terms and conditions. So in this video I want to discuss all details which is required. For example, in last video we discussed the CPT code details. In this video we'll start from the HIPIX code. So what is the HIPIX? And this is a part 2 of the denials of billing codings. HIPIX codes Healthcare Financing Administration's Common Procedure Coding System. It is a full form and pronounced HIPIX three level system of codes. Level 1 American Medical Association current procedure terminology CPT code. Second code is the alphanumeric codes which include most of the non-physician items or services such as medical supplement, ambulatory services, prosthesis, etc. These are items and services are covered by the CPT and procedure. Level 2, level 3rd, local codes used by the state Medicare organizations, Medicare contractors, and private insurers for the specific area or programs. So, what is the difference between CPT codes and HIPIX codes? Both are the procedure codes, both are a 5-digit. CPT codes are numeric, but HIPIX codes are alphanumeric. CPT codes are used for report medical, surgical, and diagnostic services performed by the healthcare professional. However, HIPIX codes are used when used to report medical procedure and services to the Medicare, Medicaid, and other health insurance program. So this is the differences between HIPIX code in, so you are clear on that what is the HIPIX code, what is the like CPT codes. Let's move to the deductible. Deductibles amount. Deductible amounts or charges a specific amount of money that is insured must pay before the insurance company start providing the benefits. So this is the amount which is paid to patient paid to the insurance company before starting the insurance. Medicare and commercial insurance started in a January of the each year. Tricare insurance started in a October of the each year. So you will see here Medicare or commercial insurance first insurance started and that amount need to pay in a January. For the Tricare insurance it will be in the October for the each year. Examples is the annual deductibles for all Medicare Part B beneficiaries will be the $240 and in 2024 an increase $14 from the annual deductibles of the 226 in 2023. So this is a like example given in 2024 this much amount 240 and in 2014 2013 it was a 226. So each year they are increasing a $14. So this way you can understood a deductible amount. Diagnosis related group that is called DRG. So diagnostic related group DRG are used to the group patient with the similar clinical conditions and treatment needs. For example, a patient who has undergone a knee replacement surgery would fall under DRG 469. Major joint replacement or reattachment of the lower extremity with MCC, major complication or comorbidity. So this is the terms and details are coming into the diagnosis related group that is called DRG and it will be part of the IPDRG. Durable medical equipment DME. The medical equipments that can be used many times, or a special equipment ordered by your doctor is usually for at home. Coverage for the DME may include oxygen equipment, wheelchair, crutches, or blood testing strips for the diabetes. So these are DME definitions. What is the eligibility? What is the eligibility? A determination of the whether or not a person meet the requirement to the participate in the plan. So that is called eligibility. There is the next terms is coming, explanation of benefit, EOB. A statement sent to patient or you by the insurance company after they processes a claim, sent them to the provider. The EOB listed the amount billed, the allowed amount, the amount paid to provider, and any co-payments, deductibles, co-insurance due from patient or you. The EOB may details in the medical benefits of an individual or family. So this is the called EOB, where the receipt sent by the insurance company to the provider to the patient, how much money they paid and how much money is the remain with a reason like denial reasons, COV reason. These all details are here. So EOB posted after the like sending claim to the insurance company, then they are sending details. Federal tax ID number, a number assigned by the federal government to the doctor and hospital for the tax purpose only. It is issued by the Internal Revenue Services, IRS. So this is a tax purpose, one number is generated. Grantor, the person responsible for the paying the bill. The grantor is always the patient unless the patient is an incapacitated adult or unemancipated minor, so under age 18, in which cases grantor is the parents of the patient or legal guardian. So these are a grantor. You know that if the one person who is not responsible for money, the another person will be responsible. In this case, child parents are the grantor or legal guardian is a grantor for this scenario. Health saving account, HSA. Health saving account, HSA, are like a personal saving account, but the money in them is used to pay the health care expenses. You, not your employer or insurance company, own and control the money in your healthcare saving account. The money you deposit into this account is not taxed. To be ineligible to open an HSA, you must have a special type of health insurance called high deductible plan. So in this kind of things, you should open one account, and that amount will be used for the payment of the insurance or provider. That time, health saving accounts are there. High deductible health plan, HDHP. High deductible health plan. High deductible health plan, HDHP, with a health saving account, HSA, provide the medical coverage and tax free way to save your future medical expenses. A high deductibles health plan does not usually cover healthcare cost until the deductibles has been met, which means you will be responsible for healthcare cost out of pocket until you meet your deductible. Once the deductible has been met, eligible healthcare expenses will be covered by the plan. Home health agency, an agency that treats the patient in their home, that is called home health agency. Hospice, so you'll see here hospice care is a types of health care that focused on the palliation of the terminally ill patient pain symptoms and attending to their emotion and spiritual need at the end of life. Hospice care priorities comfort and quality of life by the reducing pain and suffering. Palliation, relief of the symptoms and suffering caused by the cancer and other life-threatening diseases. Palliation helps a patient feel more comfortable and improve the quality of life, but does not cure the diseases. So that comes under the hospice. Individual insurance, health insurance purchased by the individual, not as a part of the group plan or any companies. Intensive care, the medical or surgical care unit in a hospital that provide the care for the patient who need a more care than the general medical or surgical care unit provided. Long term care, the care received in a nursing home, that is part of the long term care. Medical billing, medical billing and coding is a process of the submission and following up and on a claims to the insurance companies to receive the payment or reimbursement the amount. Medical Summary Notice (MSN), a statement that Medicare sent to you after its process a claim from the provider for the service provided to you, also called Explanation of the Medicare Benefit (EOMB). The EOMB listed the amount billed, the allowed amount, the amount paid to be provider, and any co-payment deductible coinsurance due from you or patient. The EOMB maybe details the medical benefits of the individual or family. Network. What is a network? A group of the doctor, hospital, pharmacist, and other healthcare expertise hired by the health plan to take care of its member. That is called network. Non-covered charges. The charges for the medical services are denied or excluded by your insurance company, your current insurance. Observations. What is the term observation? A hospital outpatient service ordered by the physician when the physician is not yet sure that you will need to inpatient care, but you feel you need outpatient monitoring at the hospital. In the meantime, they are moving to the observation care. Out of pocket maximums, the most of the money you will have to pay, it is before your insurance company cover 100% of your care. Each plan set of the dollar limit for the calendar year. Once this limit is reached, the plan will be cover 100% of the allowed amount for the eligible charges for the remainder of the calendar year. Some insurance company do not include the certain cost in these limits, such as fertility treatment or prescription drug. Other insurance company increase the out-of-pocket maximum for the care provided by out of the network providers. Peer ID, the term is used here, peer ID. The peer ID or this point will discuss into the next video. So thank you for watching my video. Let's discuss next point into the another video.